Shaheen, I'm hearing the same thing in Delaware that she's hearing in New Hampshire, which is cries of concern and anxiety from parents, from children, from employers, from families, not knowing what will be in the Republican health care bill. We've now just heard from Leader McConnell that there may be a big reveal next Thursday, but this is much more akin to a reality TV show reveal than to the legislative process that should produce a serious and thorough bill that will remake health care in America. As Senator Shaheen mentioned, in the process that produced the Affordable Care Act, there were a remarkable number of hearings. Lots of my constituents have forgotten that record, and we rely on the media to help set this record straight, because some of our colleagues are saying that the process that produced the Affordable Care Act was also secretive, was also behind closed doors, and nothing could be further from the truth. The Senate Finance Committee held more than 50 hearings, roundtables, and walkthroughs, detailed reviews of the bill that were public. They spent 8 days marking up the legislation in committee, during which they considered more than 130 amendments. There were, in the Health Committee, 47 hearings and more than 147 amendments, and Republican amendments were accepted in both of these committees. That's a far cry from the dark of night behind closed doors. We are ashamed of this bill process being followed by the Republicans. Why might that be the case? Because they can't meet the promises made by President Trump on the campaign trail. He made a few promises, and I quote, "We're going to have insurance for everybody, lower numbers, much lower deductibles, and much less expensive, and more better." I don't think that without a hearing, we can know, and without a markup, we can know that the legislative process is going to produce those results. In fact, I'm fairly confident it won't. It doesn't have to be this way. Our entire caucus sent a letter to our Republican colleagues saying, join hands with us and work together to improve the challenges of the Affordable Care Act. As Senator Schumer said, the failure to sustain some of the cost-sharing provisions is what is driving up rates in my state and many others. We could be finding a bipartisan path together, but instead, sadly, our Republican colleagues are choosing to pass an important bill that they've developed behind closed doors, that they will only release at the last moment and without a single hearing. Folks, this is not the way to fix what ails American healthcare. Thank you.